What happens if fibroids are not treated? If a lady who has fibroids that are not symptomatic, not causing her any problems, any distress, and don't particularly need any intervention and just leaves them alone, what happens to the fibroids eventually? Stay tuned to the end of this short video while I tell you exactly how it happens and the outcome. Hello, I'm Dr. Sylvia and this is Askawayhealth, the channel where we provide you with direction and clarity about everything medical. Subscribe to my channel, and when you do, please click the notification bell so that every time we publish a new video, which is usually once a week on Saturdays, you'll be amongst the first people to find out about it. Today, we're just asking ourselves that little question: what does happen to fibroids if no treatment is given to them, if we don't do anything about them? A little bit of background: if you're new to my channel, we talk about everything that's medical and we discuss medical symptoms and treatments in simple terms. We've been talking about fibroids for a while. We know that fibroids are benign growths in the womb. They're very common, happening in 30 to 40% of women. Most of the time, fibroids are asymptomatic, and that means that they do not cause any symptoms. In fact, they could be so small, a woman might have fibroids and she doesn't even realize. It doesn't affect her periods, doesn't cause any symptoms like pain, doesn't affect her fertility, nothing. She knows nothing about them. But there are some significant other percentage of women that will have symptoms of fibroids, and in other videos we have looked at this extensively and we have talked about how they can be treated as well. Now, in such a woman who doesn't even know she has fibroids, is she at risk at developing any problems later on in life? So for example, after she's completed her family or even entered the menopause, could the fibroids develop into something else? A woman who has asymptomatic fibroids before the menopause doesn't really need to do anything about them if they are not giving her any symptoms or distress. What we just recommend is that if the fibroids are detected, they only need to be monitored, and that might not need to be to do anything more than just have regular yearly meeting with your doctor to check that the fibroids are not getting bigger or causing any problems, full stop. Now, if you recall, in one of our other videos, we have linked the development and growth of fibroids to hormones. Now, as a woman approaches the menopause, these hormones that affect the growth of the fibroids begin to reduce in their levels. And so what we expect naturally is that those fibroids should begin to shrink. So a woman who has fibroids that are not really doing anything, not bothering her, should expect that as she grows older and approaches menopause and enters menopause, that these fibroids will eventually shrink without causing any problems. Now, menopause is that time of a woman's life where her reproductive hormone levels begin to go down gradually. By the time a woman has reached menopause, she's no longer ovulating, and it's also associated with other features that are linked to the change and reduction, in particular, in the levels of hormones, particularly estrogen. In the next few weeks, we shall be doing a video series on menopause, but in the meantime, I have put a link in the description below to our website where we talk about menopause and give you lots of information in infograms and blog articles. So if you'd like to read about that, please click that link, and while you're there, subscribe to our website www.askawayhealth.org. So what we're saying is that by the time a woman has reached menopause, she really should not be having any problems with fibroids. So no bleeding, no painful periods, or well, no longer having periods really, but not having pelvic pains or back pains or problems with her bladder, affecting the urine or constipation, etc. So if a woman after the menopause begins to have a swelling in the abdomen or the pelvis, or begins to have any bleeding after she has completely stopped the menopause, it is very important that the woman sees the doctor and receives advice on the symptoms, receives investigations and treatment to work out what's going on, because that is not normal. That is not an effect of fibroids. In some cases, it might be associated with cancer of the womb or other different conditions. Whichever the case, it must be checked out promptly. So that answers the question: what happens to fibroids eventually if they're not treated? If you're a woman who has fibroids that are asymptomatic, you adopt a watch and wait attitude, but have regular checkups with your doctor to make sure the fibroids are not changing, not gaining, not increasing in size. As you approach the menopause and enter the menopause, the fibroids should naturally shrink. And the warning that we give to women is that if after the menopause they develop irregular symptoms like bleeding or experience any heaviness or mass in the abdomen, don't just assume it's the fibroid. Please get that checked out. Thank you for watching. That's the end of the video. If you've got any questions on this topic, feel free to send me an email. It's on info@askawayhealth.org. I will leave all our contact information in the description below. If you found it useful, please leave a comment for me as well. Don't forget to subscribe to the channel and click the notification bell. And do please share this video with any of your friends that you think might find it useful. So until the next time I come across your way, take care.